Welcome to Raise the Line with Osmosis from Elsevier, seeking solutions with leading experts on how to increase healthcare capacity so people can get the care they need during the pandemic and beyond.
Hi, I'm Shiv Gaglani. Today we're going to tackle a question that's of keen interest to the learners in our audience, but it matters to the general public as well. As the rate of new medical knowledge continues to accelerate, how can medical students and practitioners keep up with it all and make sure they are providing the most up-to-date care to their patients? Well, we have an excellent guide with us today to help sort through that issue. Dr. Sievert Weiss is the co-founder of AMBOSS, a medical technology company whose platform has greatly improved the way medical knowledge is acquired and utilized at the point of care. Since starting in 2012, the company's international team has grown to over 400 physicians, scientists, and software engineers, serving more than 2 million healthcare professionals in over 180 countries. And I've gotten to know Sievert over the last few years, as well as his co-founder Majid, who we met up with in New York City a couple of months back. And I'm just really impressed with everything they've achieved. So Sievert, thanks for taking the time to be with us today.
Thank you so much, Shiv. It's a pleasure and an honor for me to be here.
Thank you. And obviously I know a lot about your background and your founding story, very similar to what motivated us to create Osmosis. But for our audience who definitely has heard of AMBOSS, but may not have heard of the founding story or you yet, what can you tell them about your background and what got you interested in medicine and then ultimately founding AMBOSS?
Yeah, sure. So what got me interested in medicine? I was, let's say, a good student, but I had no extraordinary skills in school. So there wasn't anything like physics or so where I was just the brain or so. So I liked sciences overall, and I liked more the application of the sciences. And so essentially I wanted to study something that is very close to a human need and above all, not a luxury. So this is what I found in medicine and in the health of the human beings. And that fascinated me and motivated me to study medicine. Now, when studying medicine, now onto the founding story of AMBOSS. So roughly 6 years later, we were studying in a group of 3 friends for the final exam. And that is very similar to how it's looking like in the US. In our case, that was in 2010, and we felt the preparation was super frustrating. It was a lot of details that you had to remember, and it took a lot of time. It was not very efficiently made. And so there were actually, and I won't tell you who it was, but there were 2 of us in the group of 3 who taught the other one a lot of the topics by explaining them. And that worked super well for us because, as you know, explaining topics helps you retain a lot of the information and really understand them. And the other person was just a super auditive learner, and he would remember most of the things that you would tell. So that worked super well. And at some point we were wondering, why isn't there a software who would do this, basically teaching the concepts and everything that is needed for the exam. And this is basically kind of like the starting point of AMBOSS, where the idea came up. So how would an efficient and effective preparation and a sustainable preparation look like, and where you really understand what this is about. And so essentially it's basically about solving our own pain point at the time that brought us to work on AMBOSS.
Yeah, that's obviously incredibly relatable. And so the product has gone through many iterations over the past decade or so since you started the company. Can you tell us what's the current iteration and what gets you most excited? Because I know you obviously have a very robust offering for medical students, but a lot of practicing providers use AMBOSS, and especially in Germany, with point of care. So can you tell us a bit more about the user experience today?
Yeah, I mean, first of all, maybe you can imagine AMBOSS like a Wikipedia by physicians for physicians, with educational add-ons here and there. And we aim AMBOSS to be like this lifelong companion for the medical professional. And in Germany, it already starts kind of like at day 1 of med school and accompanies the physician until becoming a specialist. And this works super well as we believe in kind of like this continuum of medical knowledge. So, you start with basics and then everything builds on top of that. And you learn about the the diseases, and then how to treat the diseases, and then specialize in how to do this treatment. This is kind of like the blueprint that we follow for both our German and English versions, only that the English version is a bit behind.
I remember still when we were, I was at an AMSA, American Medical Student Association meeting, probably 2016 or 2017 in DC, and you guys had just set foot on the US market. And again, very impressed with everything you've accomplished, expanding outside of Germany, where you have a really solid market penetration there. So, you're in the business of medical knowledge, and you're a physician yourself. One of the biggest things we've learned over the last several years because of the pandemic and just general societal turmoil, social media, et cetera, is medical information, medical misinformation, disinformation. Can you talk to us a bit about how we should change medical education to reflect the tsunami of medical knowledge and ideally combat this issue of misinformation and disinformation?
As you know, the tsunami of medical knowledge, right? There is this urban legend or somewhat statistic of a certain basis that says medical knowledge is currently doubling every 73 days or so. Not all of that knowledge that is comprised in this is probably clinically relevant knowledge, but still it's hard to sift through and get an overview of this. And now medical studies are basically still taught in the same way they were 100 years ago, and that is basically students being presented with facts that they are expected to memorize, and half of which is outdated by the time they leave university, probably. So we're really, I guess, reaching a cognitive boundary here, right? If we look at this exponential growth of the knowledge, and on the other side, the kind of aptitude of the human brain. So there's a systemic problem, and the answer cannot be just cramming more facts, right? So we need a different answer. We need a fundamentally different answer to this. And I think one core component of future medical education will be that we will need to teach students techniques to navigate these floods of information, right? That will be a crucial component of every physician's lives in the future. And we do have the chance with those technical advancements and, digitization and all of that to offload parts of this cognitive burden into these tools, right? And once we're ready to accept that those tools are kind of like necessary tools, like the thermometer and so on, right? I mean, we always, as physicians, we think like medical knowledge, that's what the physician is, right? But maybe, accepting this cognitive burden, we will be ready to accept tools. And I do think that really opens up opportunities to put focus on more innate human abilities, right? That have been neglected before. So I think additionally, future medical education should also focus more on basic medical principles to build foundations, right? Where you can build on top of that. It should focus on data literacy to understand and add future research insights to this. And I think another very core human skill is the human interaction, right? And essentially empathy. So that's something we always assumed you would understand along the way in medical school, but that's not the case, right? It's not really taught, and we're losing a lot of potential here. So I'm convinced that theoretical knowledge will shift to the digital space, and also with that movement become more accessible. And as I think you also outlined in one of your great articles, I think on Forbes, I also believe that there will be collaborations between, digital universities and partner hospitals and so on, right? Just increasing capacity levels for educating physicians all over the world, right? So yeah, that's mostly my kind of framework of where medical education should head in the near future, and at least think about where to move, because the current system will not meet those demands in the future.
That very much aligned, and what you just said, that reminds me of something I heard Vinod Khosla say at a conference called Future Med, which if you haven't been to, I know you would love it as well. We had the curator of Future Med, Dan Kraft, on this podcast. He's done a lot of talk on digital health and et cetera. And so Vinod Khosla said something very provocative, which was cited in many news articles, which is that 80% of what doctors do by 2025 will be obviated, right? Not necessary. And a lot of people at face value thought he was saying we don't need 80% of doctors by 2025. Obviously not what he was saying. He was saying 80% of what they do, which is hopefully a lot of the documentation, some of the medical knowledge recall, and they can focus more on the actual practice of medicine and soft skills and patient, shared decision making and those kind of things. So it sounds very aligned with how you as a physician and a successful medical education entrepreneur have seen it. So, the role of a physician is changing, as we talked about. Traditionally, they've enjoyed a very high status and have been seen as demigods in white coats. But now we have physician assistants, very fast growing field, nurse practitioners, the scope of practice is changing. And in many cases, there's models that sort of disintermediate the physician and put the patient first. So clearly, we have Amazon and CVS going big into healthcare. We have digital health companies. What is your view of what doctors should be focused on over the next 10 years? I know we talked a bit about medical knowledge and soft skills, but how do you see the profession evolving?
Yeah, I think, the one concept that I like to touch on here is this, the demigods of white, right? And just to be super clear, I think I want to say I love, respect, and admire this profession very deeply. Yeah, so I think it's super important for our society. But I think this demigods in white coats notion is not good for us. Yeah, it's not good neither for the physicians nor for the patients. And I think this is because it creates false expectations on both sides. Yeah. And on the physician side, it creates this pressure to live up to this expectation. And that means they will hide their insecurities. They always want to try to project their confidence and know everything. And as we said earlier, there will be things that they don't know. Yeah. And so I think it's important to confront this insecurity more openly. Yeah, because they should be open about it. They should be able to say, I don't know, but I will look it up for you, or I will send you to my colleague, or I will ask my colleague. And I think what we also learned from COVID times is overall we should be more vulnerable, right? We do not have endless energy. We do suffer from the circumstances emotionally and psychologically. So I think it's super important to get away from this patriarchal model to a model that is more on eye level, and that will also greatly influence our communication with patients, with colleagues, and then have ripple effects on adherence and effectiveness of treatment and so on and so forth. So overall, I think we will turn more into this kind of manager of the patient's path, but be less like this, this father or father figure that knows everything and will just tell someone to do it and have them not really understand what it's about.
It's almost like the Reformation, the Martin Luther theses, right? If, do you need a priest to communicate to God? Obviously, there are a lot of other referendums there, but or can the priest more be a guide, spiritual guide, as opposed to the one intermediary for you to get healthcare or spiritual care in that case? We've had a lot of guests on this podcast talk about digital solutions in healthcare and how it can be difficult to gain adoption of new technology. And, our speak, it's Crossing the Chasm, as I'm sure you've read that book by Jeffrey Moore. Elsevier itself released this report called Clinicians of the Future, and something like 75% of surveyed physicians believe that technology should be taught in medical schools in the curriculum. I'm curious, what are your thoughts around how do we get people more of these digital health technologies to cross the chasm? Should we be teaching these in med school or through platforms like AMBOSS and Osmosis?
Yeah, that's a very good question. I think, similar to like data literacy, I think there should be something like digital literacy, or digital health literacy. I think it'll be super important for physicians to understand what are these digital health solutions really doing? Where do I need to put my focus on? What is mature enough? What is not? I think that will both be beneficial for obviously the physicians and patients, but it will also drive adoption of those solutions. And I think today, as you said, like there are companies saying we do not really get traction in the market or so, right? I think that can have multiple reasons. One reason is definitely that physicians are skeptical, right? And they have always been skeptical towards new tools. There's this article that I once read where they say when they introduced the thermometer 300 years ago, there was an outcry in the physician population because they were like, yeah, but it's not capturing all of the aspects of a fever, right? It's just measuring the temperature. And yes, that's right. But there's a standardized way to measure the temperature now, right? and so it has taken some years to be adopted then finally. And I think that's similar with other techniques. You find a similar adoption curve for X-rays and so on. And today, I mean, there's all this talk about AI. Will AI replace the physician and so on? I think what will help any company, I think, in the healthcare system is to maybe not think about replacing, be it physicians or nurses. I'm pretty convinced that there will always be this human factor that we need, right? A human wants to talk to a human, but the tools can augment their powers and skills and do something where those tools are just intrinsically better in. But again, when the humans focus on the innate human skills, then it'll be a win-win situation. Finally, I think for any healthcare or digital health company to break into this space, in my experience, what really helps is thinking from the user's perspective and asking yourself, what is the problem? How big is it? And how much better will the experience be when I introduce my solution? And then I think you can find adoption. It usually takes a bit longer than in other markets, but it might also be more defensible.
Yeah, that makes a lot of sense. I think that's really wise advice for anyone looking to start or embrace new technology. There's a bit of the joke, right? That's a hammer in search for a nail. Like if you're a hammer, everything looks like a nail. And especially during the hype of 2021 with crypto and blockchain, some of which have legitimate applications, others do not. I was encouraged and actually did this. I bought the domain osmosisblockchain.com just in case there was something to that technology for osmosis. Maybe there will be eventually, but it makes me think about some of the hype, the Gartner hype cycle of technology adoption. And so, going back to COVID, right? We launched this podcast because of COVID. It's called Raise the Line because in addition to flattening the curve, we wanted to strengthen our healthcare system by improving training more doctors and nurses, as AMBOSS does, as Osmosis does, as Elsevier does, et cetera. What are some of the kind of other things in our health systems? And maybe this is also where you can, if you'd like, compare and contrast the German and US health system, if you'd like, that are not going well. And, what are some of the things we should be doing to fix it, to raise the line, as we say?
Yeah, I think something that you are doing here, for example, is really a great addition to the portfolio of solutions. Yeah, I mean, in the end, science is super complex. Yeah, and there is a need to explain science. Yeah, and I think what we saw in COVID times is that it's really important to make people understand and also understand what they understand. And I think this is also something that we can take away for medicine as a whole. Like, for example, when I studied medicine, the books that I read were not written in a way that I could understand them. Like I would have to reread every sentence because it was so complex and they would use so many complex terms that this is not, it's not made for understanding. It's, and I don't want to blame anyone here, but it felt more like someone wants to show off that he or she has studied so many years and become a professor or whatever. And the goal of teaching should be that as many students or as many persons understand as much as possible of that. And I think that's the same for medical students or patients or the general population. It should be about understanding. So I think we really need to rethink how we communicate with each other and understand that this is not a one-way street, right? It's not someone is saying something and then this will have an effect. No, we need to make sure, is this understood or not, or what is understood of this? And yeah, that's there. I mean, we could go deeper down that route, but I think, on the topic of science communication, that would be one important topic.
Definitely, I totally agree with that, and definitely like the way we communicate science, oftentimes it's over our patients' heads, and they, if they don't understand something, they aren't going to, take the full antibiotic regimen, for example, which can contribute to antibiotic resistance. So I agree, that's an important point, and one of the things I think our health system needs to do better, get doctors and nurses and others to be better communicators, as you're describing as well. So what are some of the other things you're thinking about for improving our healthcare system?
Now, I mean, you also said that maybe there's a comparison between the US and Germany to be made. I mean, I've looked at this before, and I've seen it here and there. That just from the outside facts, life expectancy in Germany is higher and still going up. In the US, it's declining. Germany is covering everyone with a health insurance. There's a universal health coverage, and it's mandatory. And at the same time, Germany is spending less on a per capita basis. This is not to say, hey, Germany is the best in the system in the world. And I'm pretty sure this is a complex topic of costs, delivery, insurance structure, incentives, and so on. Yeah, but just from these facts, there something seems to be off here, and if we look, for example, into the education system, in Germany, if you go to university or school, most of that is public. You don't pay for that, and it's not as simple as that, I guess. But in both topics, you find this fundamentally different approach of the state takes care of its population, or the population has to take care of itself. And this is a philosophical question, that what kind of model do we want, right? And we talked about the patriarch before, right? In this case, you could say the German state is like the patriarch. I think there might be something to be learned here. I'm definitely super far away from saying how anything of that could be turned around or so, but all the evidence and all the trends point in the direction that medical care will only grow, right? We will have a growing population basis. The patients become older and older usually. We find more ways to treat it. So we need to find a way to address these problems in a somewhat practical fashion. And in my opinion, that we do not lose too many people on the way, right? That at least from an ethical point of view, this and Hippocratical oath or Hippocrates oath, I think we should change our mind on this.
I think it makes sense, and that's one reason I'm a big supporter of this internationalization of companies as well and people. We've been in the US and, AMBOSS operates successfully in those countries and 178 other countries. Same with Elsevier and Osmosis, many, many countries, many physicians and nurses we're hiring in all these countries who can kind of come in these forums and share how they do it in their system versus the other system and ultimately turn that into education. I'm aware of the time, so I want to be respectful of yours. So my final question is just related to general career advice. I mean, you've had a very successful career as a physician, as a healthcare educator and entrepreneur. What advice would you give to people listening right now about meeting the challenges of the COVID pandemic and beyond?
Yeah, I wouldn't limit. I mean, as you know, giving advice to someone you don't know and without the context is always, I think, super hard. And now limiting it to COVID, I don't know if it would change my advice, but my advice would be from all the experiences that I made is basically follow your heart, and that might sound super trivial, but for me that has changed a lot, and it takes quite some courage to do so. And essentially, I think, think about the time that you are in, that this is your life. Yeah. Do something that you like in that time. Pursuing that can be super hard. Yeah. Especially if it's not a well-trodden path, as it was in our cases, yours and mine. But there's no need to adhere to what society expects from you. That is not what will make you happy. Yeah, if this is not what you like. So try to find out what it is that you like, and then try to do it, and you won't regret that.
Totally. That's also it's a very good general advice for people to take. And I agree with you. It's very contextual. And actually, that reminds me of one last question I had for you that I really wanted to get across. When we were on the podcast together last time, I think we were both asked as guests about our book recommendations, and you recommended William Irvine's The Art of Living a Good Life. A very good book. And I'm sure you've seen Sam Harris had him on the Waking Up podcast, and there's a whole William Irvine Stoic series, which is great, in addition to Ryan Holiday's Stoic content and his new book coming out, Discipline is Destiny, in a couple of weeks. What are you reading right now? Any other book recommendations? Because you're 1 for 1 in my book in terms of how good that one was.
Yeah, I read. I just finished 4,000 Weeks, so that's very, I think, goes in line with the Stoics. It's coming from a different angle, though. It's coming from like this productivity angle, and how can you productivize your life and things like that. But it's really fascinating to think about your life, I think, in these 4,000 weeks, right? And that it makes it very tangible that this is a limited time. So yeah, I would highly recommend that.
That's awesome. Yeah, he also, I think Oliver Berkman, I think is the author's name.
Mm-hmm.
He also was on Sam Harris's Waking Up podcast with a series. So that's great. Well, Sievert, thanks so much for taking the time to be with us today, and more importantly, for the work that you and your team at AMBOSS have done to raise the line and strengthen our healthcare system by educating so many millions of current and future healthcare professionals.
Thank you, Shiv. Thank you also for your work, and pleasure to be here and talking with you. It was a great chat.
Likewise, I really enjoyed it. And with that, I'm Shiv Gaglani. Thank you to our audience for checking out today's show. And remember to do your part to raise the line and strengthen our healthcare system. We're all in this together. Take care.
If you like this podcast, please share it on your social channels. You can also subscribe to the series and check out all of our episodes at osmosis.org/raisethelinepodcast.